All right, people. So now let's talk about high functioning depression and suicide. So suicide rate are still getting higher and higher, and then we are still trying to understand why people would engage in suicide. And one of them to look at is high functioning depression and suicide. So high functioning depression is pretty much depression as we know it. So we talk about depression, we are talking about a mood disorder, where there's persistent feelings of sadness and also loss of interest in previously enjoyable activities. So depression literally will make you feel guilty, will make you feel sad, and can even impair your day-to-day function. So when it's time for you to even go to work, you might decide to sleep because of depression. When it's time for you to go for anything that you need to go and do, you might not do it just because you are going through depression. So depression then can impair your daily functioning. Now, high functioning depression will mean that you are still going through depression, but this time it doesn't impair your functioning in your day-to-day life. You can still go about your work, go about to church, go about to anywhere, anything that you have to do during the day, you'll still be doing them. Yet you are going through depression. So therefore the term high functioning depression. So even though you are depressed, your functioning, your day-to-day things that you do, you are still able to do them. So the question we ask is this, that is it possible that people who are still engaging in suicide or attempting suicide are actually going through higher functioning depression? And the answer is that yes, it's possible. So what we are trying to say is this, that in this time, many people are going through depression, of course, high functioning depression, and they do not know that they are going through depression or high functioning depression because the symptoms are hidden and because they're able to go about their day-to-day life. And that makes it even more dangerous, that depression can therefore lead to them attempting suicide because the symptoms of the depression, which is high functioning depression, is hidden and they are not even aware that they are going through depression. So then, to help reduce the rates of suicide attempts, we all have to be on the lookout for each other, to check a friend, check a brother, check a relative, and if you see changes in their behavior, some slight changes which could suggest they are going through depression, then draw their attention, and that will be one of the ways that we can prevent suicide.